Yes, this is our closing act, so we got to give them all the love and energy. This is a really important topic. Innovating for well-being, technology, emotional intelligence, and mental health. When we were putting together the agenda for the Innovation Summit, we felt like this is a theme that is sometimes not discussed in these spaces. By introduction, I'm Kapama Yalpala. I go by KP. I'm a senior fellow and lecturer here at the School of Public Health and lead our Health Innovation Program, and I'm the lead for the health track. So we've got a wonderful panel moderated by my good friend, Dr. Yusuf Ransom, who's on our faculty at the School of Public Health. He's an associate professor and founder of the Social Society Connectedness and Health Lab, where he leads research at the intersection of social connectedness, spirituality, and public health innovation. Born and raised in Trinidad and Tobago, his work deeply is shaped by his Caribbean upbringing, the example of his grandmother as a community connector, and the faith traditions that informed his understanding of holistic well-being. So this is going to be a really fun one, so I'm going to pass it over to you, Yusuf, and then you can help us introduce our panelists.
Thank you. So thanks again for the energy, y'all. Okay. So today I'm going to introduce our esteemed panelists. They have the bios, but I think I will do justice by first allowing them to share. So, Sarana, would you please start us off?
Thank you. So just introduce yourselves. Well, thank you all for being here. One of the very last sessions of the conference. So if you need a coffee, I hope you got it. I am Zorana Ivchevich-Pringle, and I am a senior research scientist at Yale Center for Emotional Intelligence. We are housed in the medical school in the Child Studies Center, and I study all things emotions. So I study how emotions and emotional intelligence are related to well-being, and also for how we do at work. I particularly study creativity-related outcomes at work and burnout and job satisfaction.
Thank you. Good afternoon, everyone. Let me make sure this is on. There we go. Okay. I usually don't have trouble projecting my voice. All the years of singing opera helped me with that. I am Dr. Wisdom Powell. I am the CEO of Unified Youth, but I'm also the granddaughter of Eddie Powell, a Korean War veteran, and single father in our nation in a time where Black men were being invisibilized. But because of his courage and his persistence with pursuing the warmth of other sons, I get to sit here. Because of his legacy of resilience, I understand exactly what it means to remember yourself in the aftermath of trauma. I have the privilege of leading now a national organization, Unified Youth, that works at the intersection of creativity, youth mental well-being, and future readiness. And I do believe in the power of youth agency to really lead us forward and to really create the systems that will render them whole. I'm honored to be here with you today.
Hi, everyone. I'm Shams Ali Khan. I'm sitting in for my colleague, Sema Sagayar, who couldn't be here. I'm a senior manager at Sergo Health. Sergo is a public benefit corporation, and our goal is to understand the why behind human behavior. One of our portfolios is on youth mental health and really digging into what youth mental health and optimal well-being means. My background is in health policy and public health. I've worked at the National Governors Association, working on mental health policy at the state level, and also providing consultancy services to other mental health organizations across the U.S. It's great to be here.
Awesome. So we're going to kick this question off to the entire panel. So when we think about mental health conversations, we often focus on diagnosis and treatment. But what about well-being? Can you tell us what we are missing by narrowly focusing only on treatment and depression? Can you expand this definition to well-being and what we are missing?
I could take it and start off. You know, one of the things we look at Sergo is some of the upstream factors rather than just the clinical indicators when it comes to youth mental health and well-being. So what I mean by upstream factors is really looking at optimism, resilience, life satisfaction, social connectedness, because what we've found is if you just focus on the clinical factors, anxiety, depression, etc., you're missing that holistic view and that holistic perspective of how youth are feeling. And what we found is that actually, when we looked at the data, 22% of youth didn't report poor mental health or poor, anxiety or depression, but they reported poor well-being. So in an instance, they felt, they had a lack of life satisfaction, lack of optimism, lack of social connectedness. So again, it's you cannot just look at one. It's really important to kind of get that holistic perspective overall.
So I think it's obvious probably to most of you in this room that we have built a system that is focused on deficits. And so we have organized our treatment delivery resources to address what needs to be fixed or what's broken. And when we do that, it's sort of like crisis response, where your solution scope is narrowed and your periphery is blocked. And you begin to treat people as if they are problems to be solved, and particularly young people who really are wonders to behold. I think that when we solve for what is right with human beings, we actually create a solution matrix that actually allows us to deliver better population health and to actually solve for the social determinants, the conditions of well-being that are required. Well-being has to be built, right? You don't treat well-being, you build it from the ground up. And so I think we have moved away from, the root causes of what helps people to be well, and we have focused on how do we minimize symptoms. But you could be feeling good. You could have less depression, a better PHQ or GAD score, and still be fundamentally isolated and alone and psychologically deteriorating. We need to be thinking differently about systems that help people become whole. That, I think, is what well-being means to me and how I think about it in the work I do every day.
I think that what we all here agree on is that there is mental health as we think in our everyday conversation, which really means mental illness. And then there is well-being. And psychologists have recently done a field-wide analysis of what we mean when we say well-being. And there were hundreds of different terms that are used in research studies. And they analyzed them to find, okay, how do they come together? What are the ingredients? What is the core definition of well-being? And there is an emotional component of happiness or joy that is positive emotionality. That is more prevalent than the negative one. That is not to say that you only feel happy at all times. That's not possible. We are human. But then there are also components of social well-being. There is a component of meaning-making and purpose. And there is a component of competence, of dealing with the challenges of everyday life. Whether those are your making progress towards your goals or handling what life throws your way. So all of those are components of well-being when we are not talking about just illness or just symptoms of something. I was actually at another conference just last week and ended up in a conversation, I don't know how, that was about the movie Inside Out. I am an emotion scientist, and I cannot watch that movie as a movie. It's very sad for me because it's a great movie, but I always think, they're doing this well, and they're doing this well, and this nuance is really expressed. But what this person who was talking to was sharing with me is that this movie has helped him realize something very important, that anxiety, not all anxiety is pathological. Not all anxiety is an illness, that there is anxiety that comes in our everyday life because there are certain things in an everyday life that are uncertain, and that uncertainty difficulties experienced as feelings of tension and anxiety. And we have to be communicating about emotions and learning about emotions to make those nuanced differentiations, because otherwise we are going to be misinterpreting things, and there can be negative consequences of that.
Thank you. And so what I've heard so far as part of the theme is the relationships, right? So we've heard that it's not only about diagnosis, right, or the symptomology, but the fundamental aspect of being human and being part of what makes us whole. And part of that is relationships. And as many of you can attest to, we have been in a disconnection crisis, right? Really struggling with connecting with others, and it's being accelerated now with AI. Can you talk about the role of social disconnection in mental well-being overall, and how do we begin to address this?
I think one of the things we have to own is that our societal social disconnection and isolation didn't start with COVID-19. It was exacerbated and made more visible by that global pandemic. But we were already starting to disinvest in the societal and community infrastructure that actually helps people feel like they are a part of another person's life. The theory or the adage of Ubuntu, that I am because you are, was already disappearing from our society. Children with less places to go to play, less value placed on their imagination, wonder, and awe, opportunities to slow down, disinvesting in our arts programs, after school sports, treating the arts and creativity as enrichment as opposed to medicine for the soul. Arts and creativity is alchemy for the soul, and we've removed that from our communities. The isolation that we experience today, as we know, is profoundly detrimental to mental health. In fact, what the data suggests is that it's more detrimental than smoking 15 cigarettes, right? To be isolated, has that same impact physiologically, psychologically, and otherwise. And the question for me is, like, what are we going to do about it? Because I think we know it. Vivek Murthy, sort of told us all in the Surgeon General's report that young people are feeling isolated and elders are feeling isolated. And we keep creating and fueling the conditions that disconnect us from those around us. I am profoundly concerned about social isolation because I don't think that we are, even in our quest for technological innovation, are designing to solution for that. You can have 1,000 followers on a social media, 1 million followers, and still feel profoundly alone. And I think that is a truism that we have to face if we're really, serious about ending the loneliness crisis that we all face in our nation.
One of the things we do is we surveyed over 10,000 youth across the nation and ages 13 to 24, so pretty wide range. And we asked them, what does optimal well-being look like to you? And they said, having a sense of belonging, having a place to go, and social connectedness in the sense of spending time with my friends. That was the number one reason. That was the number one thing that kept standing out time and time and time again when we looked through all of these responses and talked to these youth. And when I think back to, my own youth, there were places to go, right? There were, you would just end up at the park. You would end up at a rec center. There were these third spaces that you could go to that was not necessarily your home or your school. So that is what these youth are facing a lack of. And that's what's kind of driving them more to the isolation, to Wisdom's point.
Right, so I'm going to jump in with Zorana here in terms of at the Yale Center for Emotional Intelligence, which has focused on helping people better understand their emotions regulated. Can you talk to us a little bit about why emotional intelligence is so important, specifically as it relates to mental well-being, and you can also address a bit about social isolation.
Thank you. So I work at the Yale Center for Emotional Intelligence, and that is one of those terms that everybody has heard, but sometimes it's hard to put words into what does that actually mean, although you have heard it. So emotional intelligence is an ability to accurately perceive emotion in yourself and others, use it towards better problem solving and decision making, understand it, understand the course of emotions, how one becomes another typically, and be able to manage or regulate emotions towards your goals. And that emotion regulation is the most advanced or the most complex ability of emotional intelligence, because it depends on all the other ones. You first have to identify what is going on in order to start regulating. You have to understand how emotions work in order to be able to do something about them. We have agency in relation to our emotions. We start there, knowing that we have agency in relation to our emotions, and that we know from decades of research in emotion science that if we are better able to label, identify in a granular manner what we are feeling, we are going to be regulating better. That identification is the first step towards regulating. And regulating does not only mean feeling better and feeling happier at all. Sometimes you are regulating to stay in an unpleasant emotion because you have a goal. I study creativity, and sometimes in the creative process, you have to stay with that frustration in order to learn from it and solve the problem in a creative way. So it's not always towards happiness, and emotional intelligence can help you towards greater well-being, and can be a tool for well-being, both for well-being in terms of what we were talking here as positive health, and towards prevention of those things that can become symptoms and then grow into something that requires treatment.
The next question, I'll stay with you again. So we know that youth are spending a lot of time on technology, right? And so that's one of the things we hear that's partly fueling isolation, but there are also advantages to technology. So can you share a little bit about how technology may support well-being among youth rather than undermine it?
Not all technology is created equal. So it really depends what you are doing. It's not just use technology, therefore bad. It really matters what it is. So I have a 16-year-old who just got a driver's license. May the gods be with me. Yes, thank you. Words of wisdom. What he does is he spends a lot of time online with his friends, and they are actively talking. And sometimes they are doing it in the same room while playing with other people who are not there. And sometimes they are doing it while they are, in their different houses. But there is an active conversation. They're using multiple kinds of technology because they're playing a game, and they have this other stuff all set up where there are real conversations going on. So what you are doing really matters. Technology can be a tool for learning. I suspect there might be a question of coming up later, but I'm going to jump. We have developed at the Yale Center for Emotional Intelligence a tool called How We Feel. It's an app. It's on app stores, all the app stores. And it's free. We developed it in collaboration with people, designers at Pinterest. And it is a tool that can teach you what emotions are and the nuances between emotions. So if you open it, you see that there are 144 emotions right there on the screen that appear in front of you, but you scroll through them and they're in colors and they're pretty. And there are definitions. There are tools that can teach you how to deal with particular emotions that you can then use in different situations. We are studying how people use it and what are the benefits of it. So technology can be a teaching tool, but there's also dangers in technology. There is, a couple of months ago, there was a wonderful event here at Yale about AI as a companion and as friendship tool. Wouldn't call it tool, but companion, I guess. what do we do there? What does that mean? What are implications of it? I think those are very big questions that I don't think we fully understand.
I'll switch gears a little bit and jump to you, Wisdom, in terms of a community, right? So your work emphasized community-centered approaches to dealing with mental health and well-being. Can you share what a community-centered approach looks like as we address this?
Yes, and I do believe, first, before I answer, that, to pick up on the thread that you so beautifully articulated, that true, marrying of the strengths of community with technology are possible. Digital community integration actually is possible, and I'm seeing that work happen in the world in which I exist now. When I was at Headspace as a Chief Purpose Officer, one of the things that we wanted to do was to shift the way we thought about how we support young people through the democratization of mental health resources. And we first thought we would drop this app from the sky, and then if we did, then everyone would run towards it like, one of those Hallmark commercials, and everybody would embrace, and it would be great. But what we learned as we listened to young people is that what they were asking us for were therapeutic landscapes, that it was really important that we marry that digital innovation with some community-centric resources. And so we set about to build a public-private partnership with the city of Hartford to build a mindful city. And it's those kinds of innovations, cities of awe, mindful city movements that actually really light me up inside about what's possible when we first own the limitations of technology with humility and recognize where community infrastructure lies and can be a part of the solution toolkit. So for me, a community-centric model starts fundamentally with recognizing that communities have been healing themselves for generations. That if we actually want to know what helps a young person, talk to an elder who sits on the porch every morning as that child goes to school and greets them. One of the things that I've learned is that community-centric innovations are the ones that we heavily under-resource but have the highest ROI. Community arts programs have been healing young people forever. I am a living example. I sit here today because there was a woman in my community in Norfolk, Virginia, during the height of the crack epidemic, like many of us who were children of the 80s lived through. I lived in a public housing community where all around me was sinking sand. And this woman saw a potential in me, pulled me out of that community. So instead of being in the community on nights when the block was hot, I was actually with her dancing, singing, learning arias. And because she saw value in me as a creative human being and helped me use that tool to remember myself and metabolize the traumas that were around me, I sit here today, White House Fellow, Aspen Fellow, name on. And I don't say that with pride, except to honor her for actually seeing me whole, for seeing the possibility in me. And that's what community-centric care does. At Unified Youth, we are working to build wonder ecosystems, threaded community-centric support where arts-based, play-based organizations are resourced to do the work that they have been doing well for generations. And doing that in a way that's scalable, sustainable, and accessible for all young people. A community-centric model also leverages the power of youth, not just co-designers that we invite to the table with mics muted, but where we actually give them the resources they need to heal, grow, and thrive, and to solution and build the interventions that they know they need, that rise up to meet them at their highest intentions for radical healing, not just feeling better. That kind of investment takes a different frame of mind, because prevention like that, and I'm talking not just prevention that actually gets out, sees the symptom and then tries to offset it, but prevention that actually builds the infrastructure before children get to the place that they need clinical care. To invest in that, you have to shift your whole mindset, because you're not going to get a fast, flashy headline about that kind of prevention. What you will see, though, are young people in a community where there's not hostile architecture that actually invite them in and creates an aesthetic environment for them that is actually the kind that we know heals the soul. We're learning a lot from neuroarts and neuroaesthetics, a field that I am steeped heavily in today, about the power of that kind of community-centric intervention to rewire the neural networks that actually support growing, thriving, and also the children that are swimming at the deepest edges of the ocean. community first will always get us there. The question is, will we have the courage and the political will to invest and fund it?
So I'll stay with the theme of community, and one of the things I'm sure the audience is thinking about is institutions have been experiencing a decline in trust, and so we know trust is a fundamental ingredient in how we engage with community. Can you share a little bit about what that looks like from your perspective, and how do we leverage trust in this moment?
Yeah. So in the earlier parts of my career, I did a lot of work around Black men's mental and emotional health, particularly looking at social constructions of masculinities, recognizing that there are parts of our gendered lives that are biologically rooted, but there are many more that are rooted in the prescriptions, the things we're told about how we're supposed to be and show up in the world. And what I learned from those men and publishing studies around trust, testifying before the President's Cancer Panel about trust and trustworthiness, is that trust thickens and thins as we transact with systems and individuals. And people are not trusting systems because there's something fundamentally wrong with their personalities or characters. This is not an attitudinal barrier. It's actually a structural one embedded in systems of harm. So the first thing we have to do to build trustworthiness is to ask young people, why don't you trust what we're building? And when I listen to young people, as I did just a week ago, or now 2 weeks at UCLA's Youth Brain Art and AI Summit, what I heard young people say is that we're not trusting AI because we don't think it will work for us or that there's not some way to make it, to optimize it. We're not trusting it because it wasn't built with us in mind. It wasn't built with us, which is something I learned in working with Black men in barbershops around the nation. Build it with them, and then they will come.
So Shams, I'm going to come to you because Sergo has built a really strong platform for a youth mental health tracker. Can you share with the audience what insights have you learned from looking and studying these things longitudinally with a large sample of youth?
Yeah, so, piggybacking off of this topic of AI, right, we actually looked at how youth are using AI because we know they're doing it. They are using it. And what we found is that their external environmental factors is really how it's going to impact what they come away with it. So, for example, what we've done is we took the analysis and segmented and found 5 different types of users and how they're using AI. And one particular group, they may be using it for creative purposes. One particular group may be what we like to call high hope, high skill users. They're using it really for academic purposes, for school, for learning. And then there was a really big majority that was using it for emotional purposes because they didn't have that support in their real life. Again, it's coming back to their real life support and their environment. So again, what we found in the youth mental health tracker and in our data, again, is we need to design these tools that can bridge the online and the offline world. It's okay that they're using AI. We're not saying AI is bad. We're not saying the digital world is bad. But if that's all that they're using, there's definitely going to be some detrimental effects later on. So again, just designing with scrolling and screen time in mind, sort of what we did with social media, is not going to work when it comes to looking at AI moving forward.
Thank you. So this question is going to be for the entire panel. One of the things I've learned so far from the summit is that you can have a brilliant idea, well-meaning intervention, and getting it to the last mile. That takes understanding how is this going to be paid for, who's going to be. Can you share a little bit about how do we get our innovations across the last line so we can get it to the population that truly need it? What types of arguments or data do we need to persuade the audiences?
I can start with that. So I think to Wisdom's point, as well as co-creating with youth, if youth feel like they're being heard and if they are really involved in the process, and I'm starting with the research end of it all the way to the actual implementation and the innovation and the dissemination to get it out there, what we found is when they feel that they are a part of the process, the uptake is a lot higher as well.
And I also think that the ways that we bring things to market often skip the step of trustworthiness, and that's why I want to come back to it. You know, we think of that after we've faced, some assessment of like a lack of product market fit. Then we go, well, what's going on? Maybe it's that people don't trust the innovation we're building. Rather than starting and solutioning with trustworthiness as the foundation for what we build. And that does mean slowing down to go fast later. We've gotten so enamored with rapidity in this space of innovation. I actually have marveled at how quickly we brought to market some augmented intelligence related technologies, because we have great cancer drugs and drugs to treat autoimmune conditions that take years of assessment and valuing and also checks and balances before you can bring that to market. And literally you could be in your lab one night and develop a technology, and then the next day it's in your Apple store. To me, I think we owe our society, and particularly the young people who will inherit this. Kwame Appiah told us future generations will condemn us for knowing the signs and the symptoms of us moving in the wrong direction and continuing to walk in that direction. So I really feel like we could do more if we slowed down. If you're designing something for young people, bring young people together and invite them to actually give you feedback. And while we're talking about young people and standards, why don't we have them develop and design the guardrails that we say they so desperately need? Because they're actually telling us they have concerns about the technologies. If you listen to young people with a third ear, they're not saying they're using it because it's so great. It's because it's there at 3 a.m. and in the morning when they are distressed. That's what's available. That's a failure of our society. That's not an indication to keep going forward and building on new technologies. And we should be asking ourselves, just because we can doesn't mean that we should, right? That is something I think we have to keep in front of us all the time if we're going to build with integrity. And again, technology is not all bad.
This is a great question because it has multiple components in it. Yeah. I think this question is really about who is doing the innovation, how they are approaching that process, and who is going to be using it. And all of those matter. So if they are going to be people who are developing innovations and selling them or taking them to market one way or another, and they are not talking to people who are going to be the so-called end users. I really don't like that term, end user. But okay, let's park it there. Or they do not talk broadly enough, or they feel, because of our societal ideas of building through breaking and the speed through which something has to be built, they don't spend time understanding truly what they are aiming to do. Then that product is not going to be serving people that it probably with best of intentions intends to serve. So at the Yale Center for Emotional Intelligence, we work on social emotional learning programs for schools, and they are all customized for different developmental levels. What you're going to do with preschoolers is going to be very different what you're going to do with high schoolers. And what we do with high school students is doing all of what we have just discussed, is saying these are people who are developmentally in a process where they are finding their identities, they're exploring their identities, they are exerting their agency. It is important for them to see themselves as capable in all of these ways. And so the Inspire Ed program that we have built brings students in, brings students to identify the problems. We are not coming there to say, this is the problem in your school. We are inviting them to identify what those are, find out how, scaffolding the process, helping them through it. However, their creative agency is first and central. And they identify problems that we wouldn't necessarily identify, and they identify solutions that we would not identify. And in the process, are learning skills and are becoming truly part of their community and bringing others into the community.
Awesome, thank you. So I'll end on this last question by saying that you all are steeped in the data, looking at the trends, looking 5-10 years ahead. What are you most excited about? Can you share with the audience whatever enthusiasm you have for what's out there, what's possible in helping us address mental health and well-being for youth across the country?
Well, as someone who's really excited about the power of creativity as a super skill of the future, not just according to me, but also according to the World Economic Forum, I'm really excited about the policy innovations that are now taking seat. Georgia just passed H.R. 1007, which was the first national resolution to recognize arts as mental health care, paving the way to like fully reimbursable care that is play and arts-based. And I'm also excited about the social prescribing movement that is underway in the U.S. that has been long adopted in the U.K. and other places, and they're showing demonstrable impacts on longevity and mental health and even recovery from chronic diseases and conditions. It's those kind of innovations and the technologies that are being built around them. Shout out to Chris Appleton at Social RX for all of the work that he's doing. He's our partner in building our first youth art pharmacy network in Los Angeles. And I really think that those kinds of innovations that actually bridge community infrastructure with clinical care for a fully integrated model is what gets me really excited about the future for ourselves, our society, our democracy, and young people.
One of the things that really excites me is how technology is going to be able to reach individuals and youth in these underserved areas, rural areas, youth with transportation barriers, youth that have insurance issues. You know, again, technology is not all bad. And what we found is a good majority is actually going to AI or going to apps first to kind of test the waters a little bit and then going to real life support as well. So and we need to keep that in mind as we design tools to have that bridge in place, to have the correct safeguarding in place. But again, it's able to reach a large group of individuals that normally wouldn't have even gotten care, that normally would have just been completely overlooked because they live in these areas or they have these significant barriers.
As I imagine the future, I really hope that we learn from the past. We have big lessons when we're talking technology from social media. We have talked about it. Did we do anything about it? That I'm not as sure about. So as we are experiencing a new technological revolution, are we taking that into account and implementing the lessons and really listening? And what the biggest lesson for me in all of this conversation today was listening and including people and hearing people. That takes time, that takes willingness, that takes a decision to be there and be present and include different communities in the decision-making process and in the design process. So as I am imagining, okay, if I was learning from everything we have, from our different perspectives said today, in that future, I would like to see, yes, pieces of technology that can help in specific ways. Like I have worked with technology, as I mentioned, so I'm not anti-technology for sure. That can be tools for learning. That can be some communities for people. We know that there are people who may be minorities. They may be the only person with a particular, let's make it the simplest case, of a particular interest around them. They are going to find people through technology who are going to become community. And then let's find places physical spaces where we are going to bring people and allow them time to explore and to be fully present. I think that space and time is really important. That space and time in person that brings, sure, you can bring the technology in, but that part in person is where it becomes fully experienced.
Okay, so what we've heard is a couple of big things to take away. Community, we have heard inclusive design, and we are hearing the opportunity for physical space. So at this point, we're going to open up questions to the audience. Well, I see quite a few hands. But before we do, can you please join us in giving our panelists a round of applause for their time? Okay, so I think you were first, if I'm...
Thank you so much. That was a great topic. My concern, I'm going to talk about in terms of defining and recognizing emotional intelligence and mental health. Like, I was stunned by your last statement. It's a spatiotemporal issue. Like, now we're talking about cultural differences. People from different places around the world, they have their own way of defining and recognizing emotional intelligence and mental health. Some of them are open for discussing mental health issues. Some of them, they shame that. No, you should be silent. Now, unfortunately, some of those people, they import these ideologies with them when they immigrate, like the United States or any kind of place where these things are open. Don't you think that technology at some point might enforce a single cultural model of well-being that may not actually be healthy? Like, we need to account, like how you guys in your work account for these differences that are quite significant. And I'm speaking from an immigrant background and a father of a first generation Americans, like, where I can see that, like how they interact with their cousins who are not in the United States, how they deal with social media topics. Like, it's problematic. So how you guys deal with it?
So you're speaking my love language, which is, designing for the noise. When I was, learning biostatistics, we talked about homoscedasticity and heteroscedasticity. And, you're always like, you want to reduce the noise. But actually the noise is where the magic is. The noise is where the understanding is. And I think that we are on course, if we're not careful, we're creating a homogenized view of what it means to be well and whole. And when you're really honoring cultural tradition, which we are in a land of rich cultural tradition, rich diversity, despite the fact that, we don't like to own that, it is important that we do in the work around mental health and well-being. One of the things I learned about working with Black men and boys, and I'll just use that as an example, men who inherited this strong, stoic, silent way of moving through the world, not because they didn't want to honor or acknowledge their emotions, but because it wasn't safe to, and because they didn't have the language, because of normative male alexithymia in some cases, but in other cases because they were told that their emotions didn't matter and that suppression was the way to protect themselves. You can't correct that with a homogeneous innovation, right? You have to go to the root of what's happening with them and meet them there. And that's the kind of thing we were talking about, why co-design is so incredibly important. And the person who builds the innovation that can actually solve for that is going to be the person I'm going to follow down the technology road. And I think that part of the reason we don't do that is because we're solving for the wrong, sort of group. I always think when I walk into a room, I'm looking for the person who is the least served in the room. And I'm also looking for who isn't at the table that should be. Right. So that kind of thinking when you're developing technology or innovation is so critically important if you're really going to solution for the things you you described. And it's our duty and our responsibility, just like the Hippocratic Oath. Right. We have a duty of care when you're delivering these kind of innovations to society at scale. So I want to hold, innovators accountable for that. And the question is, how do we do that collectively? I'd love to talk to you more about that.
What I have heard you say is I think there are several different threads that I would like to little bit address. One is, are we going into time when there's going to be more flattening? Did I hear you right? And we know that artificial intelligence is doing a flattening. So I study creativity, and if you look at it is impressive when you just ask a question and then, oops, ideas come out. But when we analyze what are the ideas that artificial intelligence tools produce, they are very different in nature than what humans produce. So they don't come up with those things that are very, very, very obvious that humans start with, because that's how our minds work. We start with obvious and go to something that is more unusual. They don't start there. If you ask it to produce something creative, it's going to start with something that is reasonably creative. But it will never get to places that are as creative as humans are able to. So there's this flattening, everything becomes very average. So in that sense, I completely hear you that same thing can happen in the emotional space. These tools have their emotional tones, have their emotional ways of being. I actually had recently a conversation with someone about that exactly, where he was asking just a very simple question from the tool of like, where do commas go in this sentence? And it was a very simple sentence, but it had multiple parts, and he was checking where the commas go. So it was a very kind of formal sentence. The tool comes back and says, that is a beautiful written sentence. The sentence wasn't beautifully written. It's a very utilitarian sentence. There's nothing beautiful about it. But it is how the tool is, I think it's speaking directly to what you're saying. It is responding with an idea, a very culturally based idea, where the training materials are coming, mostly from English-speaking Western world, of what are appropriate ways of reacting to somebody with enthusiasm. I was recently writing a formal letter to somebody in Korea because my book came out there, and I did not know where to start. I asked this machine to draft a letter, and I laughed so hard when I got it because it was completely wrong. You do not say when you are talking to Korean that you are excited about something. That's just, in a professional setting, it's not appropriate. It's culturally not sensitive. So where we need to go is and start with cultures differ, and start with learning about different cultures, understanding that our ways of functioning are not everybody's ways of functioning, and that does not include any value statements. Those are just statements of difference. But if we do not take it into account, we are not going to be emotional intelligent, because emotional intelligence means being appropriate for the situation, which includes the background of a person. And I am also immigrant, having a first-generation son, so I completely understand what you're talking about. And I remember a proud parenting moment. I don't know how I managed this, but when he was about 6 years old, we were in Croatia, where I'm from, and he said, Mom, some things here are different. Some things are better home, some things are better here, and some are just different. And I think that most adults that I know did not quite reach that 6-year-old insight, because we are trying to impose on others ways of being that might not be culturally appropriate. And if they're not culturally appropriate, they cannot be emotional intelligent.
We're going to try to get a few more questions to the back and then to the front, please.
My name is Jared, and I appreciate the work you're all doing. I did all my medical training in Baltimore, and one of the most, I'd say, profound interactions I had in all of my time there was with an emergency psychiatrist who framed kind of the development of addiction as when a young person is exposed to a substance during this kind of real profound maturation, neurologic maturation process. They don't develop the native coping mechanisms that as an adult you would label as productive or mature. And so even when they become sober, they don't have those skills as an adult to lean back on, which is why it's so hard. And I'm not a psychiatrist, maybe as far from it as possible, orthopedics, but I think about today where we have maybe an even more pervasive source of instant gratification. You referenced some of them, social media, chatbots, video games, all that stuff. And I love the interventions you're talking about of empowering people from a young age, but I'm curious your thoughts. One, do you buy that analogy? And two, how we can continue to inspire young people to develop those mature mechanisms to deal with life's stress as they get older and maybe those conveniences go away.
Thank you for that question. I am not an expert in addiction, and as a scientist, I'm not going to go there because I'm not an expert in it. So I don't know about the addiction part. But I think that often what happens, not just in addiction, I think in other contexts too, that people do not develop abilities to deal with emotions, to understand them, to know what to do with them, and to manage them. So in the case that you shared with addiction, person might become sober, but now they need to learn other things. And the good news is, based on our research, is that skills of emotional intelligence can be learned not just in childhood. We think of starting in childhood because it's easier to start in childhood because then you go through the rest of your life and have it the rest of your life. But it is possible to learn it at other times too. So we have now several meta-analyses that are showing that in the workplace context, we can teach these skills and they can be learned there. So this is possible. And that's an important starting moment. When we do work in schools, have you ever... Okay, step back for a second. Have you ever had a boss... Have you ever had a boss who thought that they were really good at reading emotions, but oh my God, they were not? Right. We all had. Of course we did, right? And so now imagine this, same example, an adult, grown person, being an educator. And now they are supposed to be teaching children how to understand emotions and how to manage emotions. They cannot. If they themselves don't have it, everything that they're teaching just becomes a checklist. It's not lived. And we learn from observation. We learn from not just but what you say, but what you do, right? So in all of our programs, we start first with adults and develop skills in them. And then, only then, in the second year of implementation, we go to children. Because if we go the other way around, potentially there could even be harm. So yes, all of this is possible, and it's possible to learn.
So I'll just add quickly, because I know we want to get to another question. In my experience of treating hundreds of people at this point in my career who have battled addiction and substance use and misuse, what I've often found at the root of that was some sort of injury to the soul. And people are typically leveraging substances in those moments to self-medicate. And for some people, it's compulsory because it's rooted in some genetic predisposition that pre-wires them for that way of coping. But at the root is a damage to the person's sense of, I don't want to say meaning making, but putting themselves back together after the wound has occurred. And I think you can teach. I've seen this with people who are in the throes of addiction and haven't had a relapse, and relapse, as we know, is a part of the process. But coming back from that, what I've seen shift in them was a capacity to sit with the difficulty, the initial injury or wound, emotional wound that they've experienced, and developing the skills and the tools to regulate and move through that. Not push it aside or numb themselves to it, but to truly feel it. And I don't buy this idea that if you have the kind of hardwiring that starts at birth, that you are predestined for doom. Because I've actually also seen people who've had that and never touch a drink and never touch, a substance, and not even develop the so-called addictive personalities that we were all taught were hardwired. I think that there's hope for every person who stands at that cliff, but we have to support that person with getting the tools to actually process and metabolize what's really at the root of their numbing and actually distancing themselves from the experience. All of us experience difficulty, and we numb ourselves in different ways. We just don't call it that. I think helping people see the possibilities that lie with a more healthy way of coping is really the way forward for those folks. So I don't believe people are destined to fail who start that way.